Welcome to the ultimate guide on understanding acetaminophen. Whether you're experiencing a headache, fever, or any other kind of pain, acetaminophen is likely a go-to solution you've turned to. But do you really know everything about this commonly used over-the-counter medication? In this comprehensive video, we'll delve into the uses, dosage, and potential side effects of acetaminophen, ensuring you have all the knowledge you need to make informed decisions about your health. We'll explore the various conditions acetaminophen can effectively treat, its recommended dosage for different age groups, and precautions you should take to avoid any adverse effects. Additionally, we'll discuss potential side effects and interactions with other medications to ensure your safety and well-being. So, whether you're a first-time user or simply looking to refresh your understanding, let's dive into the world of acetaminophen and arm you with the information you need for a healthier, pain-free life. What is acetaminophen? Acetaminophen, also known as paracetamol, is a medication that belongs to the class of analgesics, pain relievers, and antipyretics, fever reducers. Unlike nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or aspirin, acetaminophen does not possess significant anti-inflammatory properties. It works by inhibiting the production of certain chemicals in the body that signal pain and regulate body temperature. Acetaminophen is available in various forms, including tablets, capsules, liquid suspensions, and even suppositories, making it easy to administer and suitable for different age groups. It is widely used for its effectiveness in relieving mild to moderate pain and reducing fever. Acetaminophen is commonly used to alleviate headaches, muscle aches, toothaches, menstrual cramps, and pain associated with colds and flu. It can also be effective in reducing the discomfort caused by arthritis, including osteoarthritis and rheumatoid arthritis. Additionally, acetaminophen is sometimes prescribed to manage pain after surgical procedures or injuries. Its versatility and availability without a prescription make it a popular choice for those seeking relief from various types of pain. Acetaminophen is not only used for pain relief but is also a common ingredient in many combination medications. It can be found in over-the-counter cold and flu remedies, cough syrups, and sleep aids, often combined with other active ingredients to provide comprehensive symptom relief. However, it is essential to be cautious when taking multiple medications containing acetaminophen to avoid accidental overdose, as exceeding the recommended dosage can have serious consequences for your liver. Dosage recommendations for acetaminophen. The dosage of acetaminophen depends on factors such as age, weight, and the specific condition being treated. It is crucial to follow the recommended dosage instructions to ensure safe and effective use. For adults and children aged 12 years and older, the typical recommended dosage is 325,650 mg every 4 to 6 hours, not exceeding 3,000–4,000 mg per day. It is important to note that higher doses do not necessarily provide better pain relief and can increase the risk of adverse effects. Always read the label carefully and consult a healthcare professional if you are unsure about the appropriate dosage. For children between the ages of 2 and 11, the dosage of acetaminophen is based on their weight. The general guideline is 10–15 mg per kilogram of body weight, administered every 4 to 6 hours, up to a maximum of 5 doses in 24 hours. It is best to use an appropriate measuring device, such as a syringe or a dropper, to ensure accurate dosing. Care should be taken to avoid exceeding the recommended dosage, as children are more susceptible to the potential side effects of acetaminophen. For infants under the age of 2, the dosage of acetaminophen should be determined by a healthcare professional based on their weight and specific condition. It is crucial to follow the healthcare professional's instructions and not administer adult or child formulations without appropriate guidance. Potential side effects of acetaminophen. While acetaminophen is generally considered safe when used as directed, it is not without the risk of side effects. Understanding the potential side effects can help you make informed decisions about your health and ensure the safe use of acetaminophen. The most common side effects of acetaminophen include nausea, stomach upset, and skin rashes. These side effects are usually mild and resolve on their own. However, if you experience severe or persistent symptoms, it is advisable to seek medical attention. One of the most significant concerns associated with acetaminophen is its potential to cause liver damage when taken in excessive amounts or in combination with alcohol. Acetaminophen is primarily metabolized in the liver, and high doses can overwhelm the liver's ability to process it, leading to liver toxicity. It is crucial to avoid exceeding the recommended dosage and to be cautious when using acetaminophen if you have a history of liver disease or consume alcohol regularly. Should you experience symptoms such as yellowing of the skin or eyes, dark urine, or abdominal pain, it is essential to seek immediate medical attention, as these may indicate liver damage. In rare cases, acetaminophen can also cause allergic reactions, including difficulty breathing, swelling of the face or throat, and hives. If you experience any signs of an allergic reaction, discontinue use and seek immediate medical help. Safe usage guidelines for acetaminophen. To ensure the safe and effective use of acetaminophen, it is important to adhere to the following guidelines. Always follow the recommended dosage instructions provided on the packaging or by a healthcare professional. Do not exceed the maximum daily dose. Use an appropriate measuring device to ensure accurate dosing, especially when administering to children. Avoid taking multiple medications containing acetaminophen simultaneously to prevent accidental overdose. Check the labels of all over-the-counter medications and consult a healthcare professional if you are unsure. If you are taking prescription medications, consult your healthcare professional before using acetaminophen to ensure there are no potential interactions. Do not consume alcohol when taking acetaminophen, as it can increase the risk of liver damage. If your symptoms persist or worsen after a few days of using acetaminophen, consult a healthcare professional for further evaluation. By following these guidelines, you can maximize the benefits of acetaminophen while minimizing the risk of adverse effects. Acetaminophen versus other pain relievers. Acetaminophen is often compared to other pain relievers, such as ibuprofen and aspirin. While all these medications aim to alleviate pain, they differ in their mechanisms of action and potential side effects. Unlike acetaminophen, ibuprofen and aspirin belong to the class of NSAIDs, which not only provide pain relief but also possess anti-inflammatory properties. They work by reducing the production of prostaglandins, substances that promote inflammation, pain, and fever. This makes NSAIDs particularly effective in managing pain associated with inflammation, such as arthritis. However, NSAIDs can also have gastrointestinal side effects, including stomach ulcers and bleeding, especially when used for prolonged periods or at high doses. They may also interact with certain medications and be contraindicated in individuals with specific medical conditions. Therefore, it is crucial to consult a healthcare professional before using NSAIDs. Acetaminophen, on the other hand, is generally considered safer for individuals who cannot tolerate NSAIDs or have conditions that contraindicate their use. It is less likely to cause gastrointestinal side effects and is generally well tolerated when used as directed. However, it is important to note that acetaminophen does not possess significant anti-inflammatory properties, so it may not be as effective for conditions primarily characterized by inflammation. The choice between acetaminophen and other pain relievers ultimately depends on the specific condition being treated, individual health factors, and the presence of any contraindications or interactions with other medications. Precautions and warnings when taking acetaminophen. While acetaminophen is generally safe for most individuals, certain precautions and warnings should be kept in mind to ensure its safe use. Do not exceed the recommended dosage or take acetaminophen for longer than directed. Doing so can increase the risk of liver damage. If you have a history of liver disease or consume alcohol regularly, consult a healthcare professional before using acetaminophen. If you are pregnant or breastfeeding, consult your healthcare professional before using acetaminophen to ensure it is safe for you and your baby. If you have any underlying medical conditions, such as kidney disease or bleeding disorders, consult a healthcare professional before using acetaminophen. If you are taking any prescription medications, including blood thinners or other pain relievers, consult your healthcare professional before using acetaminophen to avoid potential interactions. Keep acetaminophen out of reach of children, as accidental ingestion can be harmful. By following these precautions and warnings, you can ensure the safe use of acetaminophen and reduce the risk of adverse effects. Acetaminophen for different age groups: children, adults, and seniors. Acetaminophen can be used by individuals of different age groups, but it is important to consider age-specific dosage recommendations and potential risks. For children, acetaminophen is a commonly used medication to relieve pain and reduce fever. However, it is crucial to use the appropriate formulation and follow the recommended dosage based on the child's age and weight. Using adult or older children's formulations in younger children can lead to inaccurate dosing and potential harm. Parents should consult a healthcare professional for guidance on the safe use of acetaminophen in children, especially infants and toddlers. For adults, acetaminophen is generally considered safe when used as directed. However, individuals with underlying medical conditions, such as liver disease or alcohol use disorder, should exercise caution and consult a healthcare professional before using acetaminophen. It is also essential to follow the recommended dosage and avoid exceeding the maximum daily dose. For seniors, the use of acetaminophen should be approached with caution, as older individuals may be more susceptible to its potential side effects. Age-related changes in liver function and the presence of comorbidities or medications can increase the risk of liver damage. Seniors should consult a healthcare professional before using acetaminophen and follow the recommended dosage to ensure their safety. Alternative options to acetaminophen for pain relief. While acetaminophen is a commonly used pain reliever, it may not be suitable for everyone or effective in all situations. Fortunately, there are alternative options available for pain relief. One popular alternative to acetaminophen is ibuprofen, which is also an over-the-counter NSAID. Ibuprofen provides pain relief, reduces inflammation, and can be effective in managing conditions such as arthritis. However, individuals with contraindications to NSAIDs, such as a history of stomach ulcers or bleeding disorders, should avoid using ibuprofen. It is important to consult a healthcare professional before using ibuprofen, especially if you are taking other medications or have underlying medical conditions. Another alternative to acetaminophen is topical pain relievers, such as creams, gels, or patches. These products are applied directly to the affected area and can provide localized pain relief. Topical pain relievers are particularly useful for conditions such as muscle aches, joint pain, or minor injuries. They have the advantage of minimizing systemic side effects and can be used in combination with oral pain relievers when necessary. For individuals seeking natural alternatives, some herbal remedies, such as turmeric or ginger, have shown promise in reducing pain and inflammation. However, it is important to note that herbal remedies may not have the same level of scientific evidence or standardization as conventional medications. Consultation with a healthcare professional is recommended before using herbal remedies for pain relief, especially if you are taking other medications or have underlying medical conditions. In some cases, non-pharmacological approaches, such as physical therapy, acupuncture, or relaxation techniques, can be effective in managing pain. These approaches focus on addressing the underlying cause of pain or promoting relaxation, and they can be used alone or in combination with medication. Conclusion: acetaminophen is a widely used over-the-counter medication known for its effectiveness in relieving pain and reducing fever. By understanding its uses, recommended dosage, and potential side effects, you can make informed decisions about your health and use acetaminophen safely. Remember to follow the recommended dosage instructions, be aware of potential interactions with other medications, and take necessary precautions to protect your liver. If you have any concerns or questions, always consult a healthcare professional for personalized advice. With the knowledge gained from this video, you are now equipped to navigate the world of acetaminophen and enjoy a healthier, pain-free life. Thanks for watching.